Our hospitals have to be safe. Our healthcare workers need to be protected. We talk about testing and contact tracing. Right now, our nurses and frontline healthcare workers are not even able to get tested unless they have symptoms. If they know they've been exposed to either a patient or someone who's had coronavirus, and they know they're in a position to care for other patients, many of them are not even able to get tested themselves unless they are sick. We still have some hospitals and healthcare facilities in our state that assign the same healthcare workers to care for patients in a COVID wing of the hospital, as well as to care for patients who are going to seek care for a non-COVID related issue. Therefore, extremely increasing the likelihood that our healthcare workers are not only putting themselves at risk, but putting other patients at risk. This is unacceptable, and it is a common practice in other states in the country. There is no excuse for any healthcare facility to task a nurse or a doctor or a healthcare worker to care for both COVID and non-COVID patients. On top of all of this, these healthcare workers are not tested even on a daily or weekly basis. When you think about the frequency of the NBA's testing of their players, the NHL, some of these corporations where they have people coming in, they're testing daily or every other day or maybe even weekly. Yet how is it our state is failing to provide this opportunity and this mandate of testing for those who are on the front line taking care of those who are sick and in need of care? This is not a theory. We know that this practice unnecessarily puts the lives of patients and healthcare workers at risk, as we've seen with most recent incidents at Maui Memorial. I'll close by saying the responsibility for this utter failure lies within the leaders of our state. As Chief Executive of our state, Governor Ige is responsible. His failure to take decisive action on these fronts is putting people's lives at risk. Now, I've already spoken with congressional leadership, including Speaker Pelosi, about the dire straits that the people of Hawaii are facing because of this failure of leadership, as well as the question about where are these federal dollars going if they're not going towards ensuring we have the contact tracers and testing capabilities that we need in this state. Now, the congressional leaders I've spoken to share my concern and understand the urgency of the situation that we face, and we are working together to ensure that congressional oversight and accountability occurs. We will be announcing the details of that oversight and how it will occur in the next few days. I'd like to open it up now to your questions. Again, I encourage you to take the opportunity to hear more from Jennifer as well as the other experts that we have here. Thanks again for joining us. Yes. Dr. Park and Dr. Anderson both, as I mentioned in my opening comments, if you look at the timeline of their comments from the beginning of this pandemic to currently, you see a vast disparity in the numbers of contact tracers that they have claimed are working in our state. So one of the first things I asked Jennifer when I spoke to her was, are they lying? Is there some hidden group of contact tracers somewhere we don't know about? Did they hire a bunch and then a bunch quit? What is the explanation for this disparity? There is none. So the numbers specifically that have been reported by Bruce Anderson and Sarah Park are false. And the fact that they change almost on a week-by-week basis and even differ between Bruce Anderson and Sarah Park points to the dishonesty and the lack of integrity in the leadership of the Department of Health. With Governor Ige, if I were in his position, I would be questioning the people in my cabinet and my team about how this is possible. So what he knew, when he knew, I don't know the answers to those questions, but it is his responsibility to lead and to make sure that he has a team that the people of Hawaii can trust, and that is not what we have. I'm not. And the reason why is because, as far as I know, Bruce Anderson is still the director of health. Sarah Park is still the state epidemiologist. And in any organization, when you have leaders, especially who have been charged with the public's health and well-being, who have no integrity and have lied to, I'm assuming, the governor, to state leadership, to the people of Hawaii, to all of you in the media, not once, not maybe misspoke, but numerous examples of dishonesty, rejecting assistance, saying on one day, we have enough money, we have enough people, don't worry about it. Then the next day saying, well, we don't have enough money, we don't have enough people. And the next day saying, Dr. Anderson, less than a week ago, he's saying, well, we have all the contact tracers we need. We're just keeping them on the bench for when we really need them. When is that, if not now? So no, I don't believe this change has gone anywhere near far enough to restore the integrity and trust in our state leadership and to take the kind of massive, immediate action that the people of Hawaii deserve. Correct. I think there are a number of examples where immediate congressional action has been taken, both related to deficiencies in, let's say, testing capabilities around COVID or misuse of funding. In other examples, there has been an oversight committee that has been formed specifically to oversee the COVID response and the use of taxpayer dollars. We have a congressional committee that is responsible for public health. It's a subcommittee on the Energy and Commerce Committee. So there are many different tools that Congress has at its kind of at the table to pursue very quick action. Like, I'm not looking for an investigation that's going to take 2 years. I don't want to speak before we have the details of exactly what course of action we'll be pursuing.